This morning, joining with us, we have Chizoma Nosike, president of Acclaim Home Healthcare. Chizoma immigrated from Nigeria to the US in 1995, and her very first job was in home care. We are very happy to have her here today and excited to learn about what drew her to home care, as well as her experiences as a person of color working in home care. Thank you so much, Chizoma, for being here today.
You're welcome.
So I just have a few questions. And our first question is, what drew you to home care?
Well, when I was living in Nigeria and before that living in England, we were looking to travel a little bit in the United States. And my husband at the time said, we go where the job is. And through an international recruiter, they found a home care agency at the time called What You Said Home Health, which was eventually became part of UMass Memorial Home Health. And they had an opening that they could not fill for years. There was a shortage of physical therapists. And so they recruited me internationally. And that's how I ended up in home care in Worcester, Massachusetts.
Oh, wow. That's actually very interesting. I feel like we hear a lot about UMass Memorial Home Healthcare too. So I think it's very interesting. Especially being from another country, I couldn't imagine that type of culture shock as well. But so my second question is there a patient story that has stayed with you?
Yes. Actually, this was a story of a young girl. I think it was just after I started my home care agency. It was a young girl who had immigrated from Vietnam to join her parents here. And she was a student at one of the universities, local universities, and a car hit her, and it was a hit and run situation. And she ended up with so much brain damage. And when she was being discharged from Fairlawn Rehab Hospital, very few people wanted to accept the case because she was so it looked like she had no potential to make progress. And my agency took her on, and we worked from teaching her to sit on the edge of her bed, um, teaching her mom to be able to sit her up and get her dressed. And we worked with them all the way till we could get her walking again in the house. The greatest joy I had was one day I was driving after we discharged her. I was driving in her neighborhood, and I saw her mom holding her hand and taking her for a walk down the street. That made my day.
That's absolutely beautiful because I couldn't imagine not just the impact it had on your life, as you clearly do remember it, and the joy that you had just seeing her and her mother, but also, just not giving up on her, that somebody out there believed that they could help her. And I couldn't imagine the impact that also had on not just her, but her mother as well, being able to, just seeing your daughter being able to walk and just sit up. I couldn't imagine. And I think that's just such a beautiful story. Thank you so much for sharing that. Our second question is, what differentiates your agency in the marketplace?
Well, the reason that I started my agency, I believe, is the same reason that we're different. I worked for many home care agencies after I moved here, and I realized very quickly that the demographics in Worcester, Massachusetts was changing. But I realized that the agencies that I was working with were still treating people like it was, not taking account of the diversity. And so I felt way before the word cultural competency became commonplace in home care, I felt that people needed to be trained. Home care, at the time, there was also very little diversity in the staff that worked home care. And so many patients, when they were admitted to home care, very quickly, someone branded them as non-compliant and discharged them. Sometimes it was their diet that was different, say that was making their blood sugar not come down, or it was something else that was different. Sometimes the clinicians couldn't understand, and there wasn't a lot of interpreters. There was just one or two companies that did interpreter services around Worcester, and there was a long wait to get an interpreter. So clinicians were just winging it. And the more I was part of this, the more I felt something needed to change. This was really, really not the way I had envisaged home care to be, because if someone is, speaks a different language, you need to be there with them, with that, being able to understand the language that they're speaking through an interpreter, all that. So what I did was in 2005, I decided I was going to go it alone. So I started an agency with the vision of embracing the diversity in Worcester, embracing people of different languages in Worcester. So one of the first things I did was I went into the different communities, the Southeast Asian community, the Spanish community, all the different Vietnamese community, and I found freelance trained interpreters who were willing to work with my agency. And I was able to negotiate lower rates for interpretation than what we got through different companies. And that helped us because the cost of interpreter till today is not reimbursed in home care. And I remember a long time ago, 2005, talking to the then Senator Kerry about it and saying, this is impacting home care. This is impacting the way people who do not speak English are being treated. And I remember him having a very good conversation with me at the time about, how this was happening and nobody was talking about it. Anyway, so I was able to put together a group of freelance interpreters who were willing to work with the clinicians, the nurses, the physical therapists. And I basically put cultural competency training at the forefront of my agency training. So every new employee goes through cultural competency, and it's in our core values. And every year we do another cultural competency review test just to make sure that people are aware of it. People are aware that the diversity is in the city. You're going to treat every single patient with dignity, no matter the language they speak. So up to today, I do have the same interpreters, many of them from 2005, who have become almost like part of my agency. And we have also got telephone interpreters for the languages that these freelance interpreters don't speak. And that gave us a different kind of bonding with the city. It gave us a different kind of bonding with people in the city, with the insurance companies that deal with a lot of minority groups in the city. They go to us first. They call us first because they know that one, we will not shy away from taking care of this patient because of the cost of interpretation. And then secondly, that we will really deliver quality care because we understand what the patient is saying. And for me, that's the biggest contribution I feel I've made to the city.
Wow, that's amazing. And I think it's just very important, the idea of the cultural competency. And I do know a little about Worcester and I do know a little of the diversity there. But, just knowing that when you're looking for, a clinician or someone, that they are able to understand you, because I think there are a lot of cultural barriers as well as language barriers. And just being someone who's maybe looking for home care and knowing that I can go here and they'll understand me, or they'll, you know what I mean? I think it's very important. And
Correct.
when people look for an agency. So I'm very glad that it's also very amazing that you did this by yourself,
Yes.
so I think it's just very great. And also with the reimbursement that you were speaking about as well, that this would be affordable for them as well.
Yeah.
So thank you for that. My
Yeah.
last question is, how do your interactions with clients and patients reflect your mission?
Same thing I've been talking about. So obviously, every single patient that we admit to the agency knows that they're not just a number. They're not one of thousands of people that are being serviced by the agency and come on, roll over, we move on to the next person. No, there is a relationship with the clinician, between the clinician and the patient. And so, if they don't speak English, many of them, the freelance interpreter becomes that third person in that relationship. And sometimes the patient would end up calling the freelance interpreter to say, please call the nurse, I have a problem. So, we have found a way to make this really, really work well. And many of our patients are long term patients. We have very little turnover in staff. The staff, I'll have a lot of nurses who have been with me 7 years. I have therapists who've been with me 15 years, people who've worked with me from the very beginning when I started, because they see how we do things different. And with the dignity that we bring to every patient, the clinicians also feel fulfilled. So, all in all, it's an agency that we're very proud of.
Absolutely. And especially when you have people like your interpreters, you're opening access, allowing more people to access this home care and take care of their health as well, because they're able to express exactly what they're looking for. And, a lot of people, there may be in other places where they don't have interpreters. So there are people who don't speak English and they're not sure how to even get their health care. And I think it's very important that each patient that you are treating as an individual, and I understand completely why that would make them long term. So I am very proud about that with your agency and very thankful about you doing that. I also, in the little blurb you sent us, I did what I really found very influential and inspirational, also, especially for people of color, such as myself, is how you opens your own home care agency with no loans from the bank. You sold a house. And I think that's amazing because I know this is not something this has got to be expensive. And the fact that
Yes,
you did this by yourself and
yes.
you grew from 5 people to over 40 right now, that's amazing, Chizoma.
Thank you.
That's amazing. And
Thank
I hope anyone who watches this after can take a look at what you've done and also be inspired in case they want to open their own home care agencies as well and look at what you've done and sort of maybe use that as some type of blueprint. You
you.
never know who watches this and you never know who's looking at your story. So I
And
think it's
also,
very
just one last thing, just in case there's any funders out there, banks out there, there's a lot of barriers towards people of color getting loans. And
absolutely.
I experienced it at the very beginning. I had a very hard time, not just getting the startup money, but when you have a home care agency, because of the way payments come, you need a line of credit. And it is very difficult for a person of color to get the line of credit that you need. Oh, you need this, you don't have the credit. How are you going to get the credit if you don't have the line of credit? And that's something that a lot of have tried to address in different forums that I have spoken. And the banks say, oh, we're changing things, but I think that it's still something that is a hurdle for a lot of Black people, a lot of people of color, a lot of minorities who do not have the background generational wealth to be able to say, okay, I have this amount of credit or that, and then so it's a big struggle. And so for a lot of agencies, it's one of those quick cycles of open, run for a few years, and then you have to shut down because your line of credit cannot grow with you. You're muted.
Sorry. Thank you so much. I agree 100% with you as that being a major hurdle, just not just in home care, but in life for a lot of people of color as well. So thank you so much, Chizoma, for being here today and sharing with us. I think this is very important for people to see and sharing your story. So thank you once again.
You're welcome.